An Alabama representative fighting to get a bill passed that will allow new moms to stay insured longer. The legislation aims to expand Medicaid coverage from 60 days to up to a year after giving birth.
The postpartum mortality rate for women has increased dramatically, largely due to a lack of Medicaid coverage. News 19's Archie Snowden takes a closer look at this crucial bill and shares more.
Okay, thank you, Siobhan. According to health experts, the issues affecting women giving birth does not last only 60 days. It lasts up to a year. 60 days is how long some women in the state of Alabama are medically covered after childbirth. A local lawmaker is aiming to change that fact.
I was 7 months postpartum when my postpartum depression came on.
Jane Adams said that after giving childbirth, her postpartum issues lasted close to a year. Regular doctor visits, she says, was the key.
My ability to have access to health insurance probably, it kept me functioning.
In the state of Alabama, some women have not been that fortunate. The lack of access to health care has contributed to the highest mortality rate in the recent memory for women after childbirth. Under the current law, Alabama Medicaid coverage for eligible mothers ends just 60 days after delivery.
Women sometimes will have strokes or have issues and pains that they are not able to get addressed.
Alabama Representative Laura Hall has sponsored legislation that would extend the postpartum Medicaid coverage to 12 months. Hall is urging lawmakers to fund this coverage extension in the general fund budget.
It's starting as a pilot program, but I'm a strong believer that once it's a line item in the budget, we can keep it because we're going to see the benefit and the worth of having the extension of medical care for women who've had children and longer than 60 days.
According to the Alabama Department of Public Health, nearly 70% of Alabama's pregnancy-related deaths were preventable.
Those cardiovascular conditions that contribute to so many of the deaths of new moms in Alabama, those were issues that were exacerbated by pregnancy. They were already there. And so making sure that women have quality health insurance before, during, and after pregnancy is really the only way our state is going to end maternal death.
Now, Hall says there is a common recognition from both Democrats and Republicans for this bill, agreeing that the death rate is just too high. Alabama Arise reveals that the majority of the mortality increase lies in the deaths of Black and Hispanic women. Shimon?